Anyone who's struggled with infertility knows that it's a complex disorder which can be caused by many different factors. Luckily, advancements in technology have provided specialists with new tools for diagnosis and treatment. In this video, we're going to examine one such tool called the sonohysterogram. A sonohysterogram is a kind of ultrasound used to detect any abnormalities in the uterus that may affect an embryo's ability to attach to the uterine lining. Let's take a look at how this ultrasound is performed. Upon arrival, the patient will be asked to lie down on an examination table and place their feet in stirrups, the same position used for pap smears and other vaginal examinations. The doctor will then insert a speculum and identify the cervix. A thin diameter catheter is then pushed through the outer opening of the cervix and into the uterus. Once it's in place, sterile saline is injected into the catheter using a syringe. At the same time, an ultrasound is performed, creating a picture of the interior portion of the uterine cavity and any abnormalities that may be present. There are 3 types of abnormalities a sonohysterogram can detect: polyps, fibroids, and uterine scarring. All 3 abnormalities may be corrected with follow-up procedures. Let's take a brief look at each one. The first and most common type of abnormality is a polyp. Polyps are overgrowths of the inner uterine lining, which can be quite large but are usually benign. While the presence of polyps doesn't always mean infertility, large ones can interfere with implantation, making pregnancy more difficult. The second abnormality is fibroids, which are benign tumors similar to polyps. While polyps are found in the inner uterine lining, fibroids are located in the muscle layer of the uterus and can come in all different sizes and appear in many locations. Fibroids can affect an embryo's implantation, in the same way that a rocky, uneven ground can make it difficult for a tree to take root. Fibroids can also increase the risk of miscarriage. Additionally, fibroids can interfere with the blood supply of the uterus and subsequently the development of a pregnancy. The final abnormality is uterine scarring. Scarring in the uterus often destroys the delicate lining, making it difficult for an embryo to implant. Most of the time, this kind of scarring is caused by previous surgery and, depending on the severity, can be corrected with additional procedures. Sonohystograms have become an important tool in the fight against infertility. Not only do they help diagnose some of the most common causes, the side effects of the procedure are minor, with most patients experiencing mild cramping no worse than a menstrual cycle. This makes them an excellent starting point for any infertility treatment plan.